All right, let's jump right in. Today we are tackling what is, without a doubt, one of the most critical things you'll ever do as a nurse, making sure medication administration is safe. And look, this isn't just about passing a test. This is the real deal, the core skill that protects your patients and, honestly, your own license.
So, here's our game plan. We're going to start with the absolute basics, the language of meds. Then we'll get into prescriptions and the all-important 10 rights of safety. After that, we'll look at how to stop major mistakes before they happen and how to use the nursing process as your safety net. And we'll wrap it all up by connecting everything to the NCLEX and the kind of clinical judgment you'll need on day one of the job. First things first, we have to speak the language. You can't be safe if you're not fluent in the language of medications. And that all starts with how they get their names.
So every drug starts out with a chemical name. You can think of this as its super-specific scientific blueprint. Now, are you ever going to use a name like isobutyl phenylpropanoic acid in practice? Probably not. But it's good to know that this is where the drug's identity begins. Okay, now this is the name you absolutely positively must know. The generic name is its universal passport, the official name for the NCLEX, for clinicals, for everything. This is your single source of truth. A drug only has one generic name, and that's what keeps us all on the same page. And here's where it can get a little messy. That one generic drug, ibuprofen, can be sold under a whole bunch of different trade names or brand names like Advil or Motrin. This is exactly why we always fall back on the generic name. It cuts through all the marketing noise.
All right, so it's not just about the name. You've got to know its legal status. And the big dividing line here is between uncontrolled and controlled substances. Think of antibiotics. They're uncontrolled. But things like morphine, that's a controlled substance because it has a potential for misuse. And that means it comes with a whole set of strict federal rules for handling, counting, wasting, the whole shebang.
Okay. We've got the basics down. Now let's follow the journey from the provider's order to the patient. A prescription isn't just a suggestion. It's a legal document, and you, the nurse, are the final safety checkpoint before that medication reaches the patient. I want you to burn this list into your brain. This is your safety checklist. Every single time you look at a prescription, you are mentally checking off these 8 items. If even one of them is missing, or it's illegible, or it just doesn't feel right, you stop. You do not pass go, you clarify with the provider. No guessing. Ever.
You're going to hear this term a lot, med rec, and for good reason. This process is so critical that the Joint Commission actually requires it. Every time a patient moves, comes into the hospital, gets transferred, or goes home, we have to do this. We sit down, make a master list of everything they're taking, and compare it to the new orders. It is a powerful way to catch so many potential errors. And here we are. We've arrived at the absolute core, the very heart of medication safety. If you take away only one thing from this entire guide, let it be this. These are the 10 rights you must check every single time you give a med. Look at this list. It is your shield. It's a whole system. The first 5, client, med, dose, time, route. That's the classic stuff, right? But it goes so much deeper. You also have the right documentation, the right education for your patient, and honoring their right to refuse. And then there are the 2 that really rely on your brain, the right assessment before you give the med and the right evaluation after. This is your mantra. Live it, breathe it. Okay, so we know the rules. We have our 10 rights. But let's get real for a minute. Where do things go wrong in the real world? Knowing the common traps is the first step in learning how to sidestep them. Take a good look at this list. You see a pattern? Every single one of these scary, potentially devastating errors is a direct violation of one of the 10 rights we just talked about. This isn't just academic. This is why following that process every single time is completely non-negotiable. You know, one of the biggest traps is drugs that look or sound alike. It's so frustrating. Glipizide, glyburide, dobutamine, dopamine. It's easy to see how a mix-up could happen. That's why tall man lettering was invented. See how they capitalize the parts of the words that are different? It's a simple visual cue designed to make you pause and double-check. Pay attention to it. Now, while any error is bad, some medications are, well, they're in a league of their own when it comes to risk. We call them high-alert medications. With these drugs, there is absolutely zero room for error, because a mistake is much more likely to cause serious harm, or worse. And here they are. You see insulin, heparin, IV narcotics, chemotherapy on this list. These are the big ones. Because the risk is so high, your hospital's going to have extra safety rules for them.
Most often, that means getting an independent double check, where a second nurse has to come and verify your dose calculation before you can give it. It's a crucial safety.
Okay, so how do we pull all of these rules and lists into our daily workflow? Easy. We use a framework you already know and love, the nursing process. It's not just for care plans, you know? It's a powerful, systematic way to approach medication safety every time.
You see how this works? It's a beautiful system. First, you assess, check labs, vitals, allergies. Then you plan when to give the meds. Then you implement, which is where you use your 10 rights. And finally, you evaluate. Did it work? Are there side effects? It's a continuous safety loop that protects your patient at every step.
So during that implementation step, here are some real-world practical things you need to do. Find a quiet place. Seriously, avoid distractions. Only pull meds for one patient at a time. And this is a big one. Never, ever give a medication that someone else prepared. And if a dose seems huge, like 4 tablets of something, stop and question it. Trust your gut.
All right, let's bring it all home. In this last section, we're going to tie all these safety rules directly to how you'll be tested on the NCLEX, and more importantly, how you'll use this knowledge to make smart decisions as a practicing nurse.
This is so classic for the NCLEX. They aren't just going to ask you, what is digoxin? They're going to test your thinking. They want to know if you know about the right assessment. Do you know that before you give that pill, you absolutely must check the apical pulse for 1 full minute? That's not just memorizing a fact, that's applying knowledge to keep a patient safe.
Now, what if an error happens? It's critical to report it correctly. This is a perfect memory anchor for your exams. Remember what needs to be in the incident report. But listen up, because this last point is huge. You never, ever, ever write incident report filed in the patient's chart. That report is an internal tool for the hospital, not part of the legal medical record.
Let this one sink in. Using 2 patient identifiers isn't just your hospital being picky. This is a national patient safety goal. That means it's a really, really big deal. Scanning a wristband and asking your patient for their name and date of birth might feel repetitive, but it is literally one of the most powerful things you can do to prevent a terrible mistake.
So let's end with a little scenario. You're at the bedside, digoxin in hand, and your patient says this. What do you do next? Think about it. This pulls everything together. The right to refuse, the right client education, the right assessment, it's all in play. So based on everything we've just covered, what is the very first, most important action a safe and thoughtful nurse would take in this moment? That's clinical judgment.